Welcome to Caravel Autism Health's Parent Orientation. This orientation was created to assist families and help answer questions on what to expect as you prepare for your child's treatment. Caravel Autism Health is always here to answer questions, provide support, and refer you to additional resources. Completing this orientation is the next step towards starting in-home ABA treatment with Caravel Autism Health. Please listen to the information presented and respond to questions throughout the presentation. Make note of any questions you have to discuss with your intake coordinator. The information will be provided to you in 3 different sections. When you have completed all 3 sections, you will be asked to contact your intake coordinator. In this presentation, you will learn what ABA therapy is and what you can expect from therapy, the importance of therapy schedules, who makes up your treatment team and their roles, how staffing is created for your child's team, how to prepare for treatment, your involvement in therapy, and Caravel policies. Receiving an autism spectrum disorder diagnosis can be overwhelming. It's a journey you may not have expected, but Caravel Autism Health is here to help you along the way. Our mission is, we change lives by providing the highest quality treatment to children and their families in Wisconsin and Northern Illinois. At Caravel Autism Health, we believe that every child with autism deserves an independent, happy life and to connect with the world. Helping children on the autism spectrum and their families is our singular focus. Please click on the link provided to watch a short video about ABA therapy. ABA therapy is based on the scientific principles of learning and behavior. It is an evidence-based treatment for individuals with autism. Research shows that children who receive intensive ABA therapy at an early age demonstrate significant improvements across many areas of functioning. The time spent in a quality ABA therapy program will have results that last throughout a child's lifetime. ABA therapy is a child's greatest chance for leading an independent and happy life. The goal of ABA therapy is to increase independence and improve verbal and social interactions. We develop treatment plans based on your child's individual needs and the principles of ABA. Complex skills are broken down into smaller steps to help your child learn. Data is collected and evaluated on an ongoing basis to ensure your child is making progress. Our therapy programs help children with autism and their families to develop skills, create connections, and gain confidence. Our approach is rooted in research and results. Our founders and staff are committed to being the most passionate clinicians in the autism health field. Studies have shown that ABA techniques can produce improvements in communication, social relationships, play, self-care, school, and employment. These studies involved age groups ranging from preschoolers to adults. Results for all age groups showed that ABA increased participation in family and community activities. The individual outcome of therapy depends on several factors. The responsibilities outlined in this orientation will greatly affect your child's progress. At times, your child may exhibit frustration, avoidance, aggression, and distress. It is important to note that these negative behaviors typically subside once a child begins to develop appropriate skills related to communication, tolerance, and other important functional skills. Your intake coordinator will work with you to identify your child's available hours for treatment to create the treatment schedule. Someone over the age of 18 must be in the home when treatment is provided. The schedule is an important planning tool for the treatment team because we identify and assemble your treatment team based on the hours you provide. Where you live also matters as we organize treatment teams by regions to minimize travel time between children's homes. Our therapists rely on this schedule to provide the best possible outcome for your child, and staff are also counting on you to maintain the available hours to earn their living. A minimum of 1 full year of commitment to the daily schedule agreed upon is expected. Some opportunities to accommodate changes to your agreed schedule may occur in summer and fall, but this cannot be guaranteed. Therapy sessions are typically 2 to 3 hours each with multiple sessions per day. If your available hours change or you move to another community, this could cause delays in assembling your treatment team or continuing with treatment already in place. You may be asked to complete and sign a therapy plan and family commitment to treatment before starting treatment. This document is a tool the clinic utilizes to develop a more specific schedule and build a team for your child. It also shows your commitment to being available for treatment. Please answer this question. Caravel Autism Health requires a minimum of a 1-year commitment to the agreed upon therapy schedule. True or false? This is true. Caravel Autism Health does request that families give a 1-year commitment to the agreed upon schedule. Next, we will discuss your treatment team. The treatment team works together with the entire family in the best interest of the child. Teams consist in general from 5 to 9 people, depending on the number of therapy hours a child is receiving. Every team is made up of 1 lead board certified behavior analyst or BCBA, 1 senior staff, and 2 to 6 behavior technicians. Each clinic has a clinical leader who is responsible for overseeing your child's individualized treatment plan and for supervising and mentoring other therapists who are engaging your child in therapy. This clinical leader has advanced training in autism therapy and extensive experience working with children with autism in all functioning levels. They meet with all senior therapists on a weekly basis to discuss and respond to both families and staff regarding any questions or concerns with services, programs, behaviors, etc. They conduct treatment plan reviews, also called progress reviews, for all clients. The frequency of treatment plan reviews depends on the child's needs. Senior therapists are responsible for supervising your child's treatment, overlapping with the behavior technicians, training, program development, and leading team meetings. They may also coordinate services with other professionals involved in the child's therapy, such as speech therapists and classroom teachers. The senior therapist confers with the lead BCBA on a weekly basis to ensure the child's treatment plan is implemented effectively. The senior therapist is the main point of communication between family and staff members. This position requires a bachelor's degree and at least 2,000 hours of experience utilizing ABA therapy. They also receive continuous, ongoing training throughout their employment. Behavior technicians work with children on a one-to-one basis, teaching children the skills they need to overcome limitations. Behavior technicians are trained by the senior therapist and directly supervised by the senior therapist. Behavior technicians understand behavioral principles and how to develop rapport with children. Many of our behavior technicians have obtained or are pursuing college degrees and have years of experience with children. Behavior technicians provide treatment in 2 or 3 hour sessions. 1 to 5 behavior technicians may work with your child. This depends on the amount of treatment hours per week that your child receives. We provide 40 hours of both online and in-home training specific to the Caravel approach for all behavior technicians upon hire. Training is provided by senior therapists, clinical directors, and lead BCBAs. Behavior technicians also receive ongoing training and supervision from the senior therapists. Please answer this question. Who will be your main point of communication between all staff and family members? The behavior technician, the senior therapist, or the lead BCBA? The senior therapist is the main point of communication between all staff and family members. We are committed to ensuring your child receives effective therapy in the most positive way. Board-certified behavior analysts and advanced clinicians provide clinical oversight to the behavior technicians who provide the one-on-one in-home therapy. All staff undergo an extensive caregiver background check and verification of education and experience. We also look at the number of therapy hours approved by your insurance and available staff in your location. The days of the week and times of the day that your child is available for treatment also determine how we can provide staff. Caravel Autism Health is an equal employment opportunity employer. Because consistency is a major component in the success of a child's progress, Caravel Autism Health makes great efforts to keep staffing changes to a minimum. It is a policy of Caravel Autism Health to make a reasonable effort to improve the overall effectiveness, professionalism, and knowledge of all staff. Despite Caravel Autism Health's best efforts, staff turnover is possible. There are positives to having a new or different staff join a child's team. Having a fresh perspective and new ideas is a great advantage of these possible transitions. Throughout their lives, individuals on the autism spectrum will meet and interact with unfamiliar people. Working through a structured transition in a familiar and comfortable environment is a good way for individuals on the autism spectrum to learn to cope and interact with new people. Families who relocate or seek changes in the therapy schedule may experience changes in staff at all levels. There is a nationwide shortage of allied health professionals, including staff who provide ABA therapy. Occasionally, there are times when we may not have the appropriate staff immediately available in your area. We will work diligently to find the right staff for your child. We will start therapy with a portion of the recommended hours and continue to increase as more staff are brought onto your team. If we believe a staffing shortage may be an issue that could affect when your child could begin treatment, we may ask you to revisit your treatment schedule and identify alternative days of the week and times during the day for which we would have staff available. Also, please be aware that if you initially plan for a daytime schedule and you change your schedule to afternoons or after school, it may take longer to identify staff for treatment, or we may not be able to move forward with treatment. Thank you for completing Part 1 of Caravel Autism Health's online parent orientation. Please proceed to complete Parts 2 and 3 of the parent orientation.